Thanks for joining us today. We are going to really talk a bit about how we can successfully make sure that our schools are back for the winter and spring semester coming up. I'm joined by Commissioner Katie Anthus. She's the Commissioner of Education for our state, and the co-chairs of our Back to School Working Group, Rebecca Holmes, President of the Colorado Education Initiative, and Heath Harmon, director of Eagle County Public Health. And Eagle County has been one of the counties that has had a fairly successful return in-person learning throughout this last semester, and really has been a good advocate of kind of that public health lens, protecting teachers, protecting students, how schools are important for public health, that they're in session. They're going to be providing an update. Today, we're releasing the work product of the Back to School Working Group and how Colorado children can safely return to in-person learning for the winter and spring semester coming up. But first, I want to acknowledge the history that was made yesterday across America, here in Colorado. I was so proud to welcome Colorado's first shipment of the Pfizer vaccine, which was FedExed to us. I signed for it, which, if we didn't know it was coming, they would have had to leave one of those slips and we wouldn't have gotten it. So luckily we knew it was coming, signed for it at the state lab, along with Dr. Herlihy and others. And then I was in Fort Collins for the administration of the vaccine to some of the first healthcare workers who work every day in COVID wards. It's amazing, their dedication. The first gentleman who received it, Kevin Londrigan, does respiratory therapy at UC Health of the Rockies in Loveland, and he was telling me how 10 or 12 hours a day he's literally in with COVID patients, and he has pre-existing health conditions as well. So the first step in his protection, keep in mind that anybody vaccinated is not immune the next day or the next week. There's a second vaccine, which they receive 20 to 25 days later, and then 10 days after they receive that one, they have 95% immunity. It's possible that the first vaccine confers some degree of increased resistance, but that is not scientifically validated yet. What has been validated, safety and efficacy. It is safe. And after 2 doses and enough time for it to develop antibodies, 95% efficacy, really the gold standard at the end of the pandemic, and also strong indications that even for people who contract it after getting that 2-dose regime, they are the more minor cases. That also has not been validated yet, but the preliminary data points in that direction. So there were shipments received across Colorado yesterday. I joined many of those frontline workers. We'll recognize the very first Coloradans to receive the vaccine after Kevin Londrigan, Daphne Dubach, a registered nurse, Kelly Schul, a registered nurse in Greeley. Dr. Diana Breyer was the first doctor to get the vaccine. She focuses on pulmonology, really also spends a lot of time around COVID patients on COVID wards. And Nellie Eckhart, as an environmental services technician at UC Medical Health, the Rockies in Loveland. So they were among the first. It's just the beginning. The more vaccines we get, the more folks are vaccinated. We're hopeful that next week we will receive our first allocation of the Moderna vaccine. This current number is over 40,000 that we received Monday, Tuesday, and tomorrow. We expect that there will be, by the end of the day tomorrow, over 40,000 received. Those are the Pfizer vaccine. Requires very cold temperatures. Next week, we're hoping that we will get the first allocation of the Moderna vaccine. They're easier to transport and store because they can be kept in normal freezer conditions like your frozen food. Those will be prioritized for nursing home staff and residents, in large part because hospitals have these freezers, and so they're generally going to healthcare workers for the Pfizer vaccine. Moderna, it's much easier to distribute and store on site. Now, every dose that we allocate to a nursing home, to a hospital, needs to be used within 72 hours, not per the label. It can be stored longer, of course, but we in Colorado want to make sure they use it, because if they don't, we want somebody else to use it. And we'll simply move it to somebody who'll use it within a day. But generally, there's very good plans to use those and get that done. And this is the beginning of the end of the urgent public health crisis. Now, we're not there yet, and it's important to recognize that no Coloradans currently have immunity from the vaccine. Even those who just received the vaccine, it takes the 2 doses. So we're a month away from even those first folks being immune. So please, for everybody, for ourselves, for our parents and grandparents, for our healthcare workers, for our schools, which we'll come back to, please wear a mask, stay 6 feet away from others, and avoid those social interactions with people outside of your household. Just so important during this time of great high levels of transmission in the community, especially true as you make your holiday plans. We were successful, indications are, with our Thanksgiving in Colorado. Some states that had similar trends with Colorado saw a post-Thanksgiving spike, some of them even as high as 40-50%. But I'm very proud that Coloradans stepped up, by and large, reduced travel, reduced interactions. If you do want to have Thanksgiving with your family, you should quarantine. Really starting now, because we're less than 10 days from Christmas. So if you do plan to have those family get-togethers, those involved, especially the younger folks who might be more likely to be asymptomatic, very important that to protect aunts and uncles, parents and grandparents, that you quarantine for 10 days. We used to, on the 10th day of Christmas, on the 9th day of Christmas. Well, it's 10 days of quarantine for Christmas if you want to keep your family safe. Others, of course, are celebrating virtually, and others are doing the religious piece, and they're putting off the social piece to have a Christmas in July or a Christmas in next summer, which absolutely can be fun as well. For people who want to have 2 Christmases next year, gives you a good fun for, we should have everybody who needs it will have the inoculation by next summer. So everybody who wants it. So it's a good time to have a Christmas in July, and we can have 2 next year as well. So, and then for those who are engaged in the religious observance, I would just encourage you also to be careful, wear your mask. I understand the importance, but if you're in a vulnerable group, if you're in your 70s or 80s, be extra careful. I mean, really consider doing that midnight mass or the Christmas mass virtually if you can. There's a very high level of community transmission, and if you do go in person, just take extra precaution to be a safe distance from anyone else. And many of the churches have strong safety protocols in place, so please follow them. Update on where we are. Today, 2,278 cases. The number of cases down slightly yesterday and today, but so is the testing number. So we're not yet fully confident this is an actual reduction. 31,936 people tested, 2,278 positive. So let's watch it. Let's call it a cautiously optimistic trend, but we really need to see a few days where we get those testing numbers back up. It just means there's availability. If you want to get tested. Please, if you're experiencing any symptoms. So let's see if this is a real trend or not. But certainly, I think we can conclude that it's not on the increase. It's leveled off. We'll see in the next few days whether infection rates have gone down. Hospitalization rates, to put things in perspective, in early October, we had 300 to 400 people hospitalized. Now we have 1,445 people hospitalized with COVID. Now that's down from about 1,700 2 weeks ago. So still very high, very elevated based on where we were in July, August, September, October. But we're hopeful that it's leveling off a bit. And the positivity rate as well in that kind of 8, 9, 10% range. We're down from the high levels of a few weeks ago. It's still too soon to say exactly, again, whether this is a leveling off or a decrease, but let's keep it up. Be thoughtful about your Christmas plans as Christian Coloradans and secular Coloradans who celebrate Christmas observe this wonderful holiday. Please be thoughtful, be careful, protect yourselves, protect your family, protect your loved ones as we celebrate the Christmas season. Now, let's talk about schools. They're on the mind of every parent with a kid in school. They're on the mind of educators. They're on the mind of employers. We're all thinking about how we can return to a more normal life in the next semester, the winter and spring semester that's coming up. This has been an incredibly challenging year for students, for educators, for children. I'm deeply committed, as you know, with to children's education. That's my background. I was a superintendent of a school. I was served as chair of the State Board of Education. I was the ranking member on the committee in Washington, the K-12 Education Subcommittee, and I helped rewrite the federal education law, replacing No Child Left Behind with the Every Student Succeeds Act. So this is a big part of my passion, my background. A lot of my philanthropic effort was in education during my years in the private sector as well. And we know that what has been occurring this last semester simply hasn't worked for too many kids, for too many teachers, for too many parents. And we can and we must do better. Now, there's some good news. 10 months into this pandemic, we've learned a lot about the virus, about infection patterns. And we now know that schools are relatively low-risk environments for kids and for educators. That's wonderful and welcome news. And they can be a safe place when the safety measures are taken and layered on one another to be able to create a safe working environment for teachers, a safe environment for kids. Won't have the same access that parents normally have, to the classroom. There's drop-offs and ways of a very limited ability to enter the school. But at least the basic academic and social piece that kids need to thrive and that public health benefit from the schools can be recognized. Learning loss is just, it's a real problem that kids are facing. And it's even more severe for those who are already at risk, vulnerable, low income, people of color, rural Coloradans, or those who don't have access to reliable internet at home or a reliable workspace or device at home. That's why last month I launched the Back to School Working Group to examine how Colorado students across our state can return safely to in-person learning in the upcoming winter and spring semester. This working group is a diverse set of voices. It's parents, it's teachers, superintendents, school board members, health officials, paraprofessionals, really coming together. And they've all spent so much time on this, and I'm so grateful for the thought leadership coming together for this roadmap that we're presenting today on how to get kids successfully back to school in the next semester. The roadmap to in-person learning is being released today. We're getting it out. It uses data, science, transparency. We've identified the very specific action steps and key areas that will enable schools to open safely while prioritizing the health of students and staff. It includes prioritizing testing for schools, expanding contact tracing capacity for schools, continued mask wearing, regular symptom screening, effective cohorting, continued social distancing, and effective ventilation. It can be as simple as a window being open or other ventilation, continued hand washing, and of course, these are complementary. That means that if you just did one of these things, if you just said, we're going to screen symptoms, but you didn't do the mask, you didn't do the cohorting, you did the hand washing, it likely wouldn't be enough. Many schools could be back. But when you do these things on top of one another, you wear a mask, parents screen for symptoms ideally. If parents aren't doing it well, it's done at the school. Anybody with symptoms is given a test, focusing on contact tracing priority altogether. Frankly, this creates one of the safest work environments in the state, in school. They will have more safety than most of us have in office environments or manufacturing environments or anything else. And we do owe that to our kids and our teachers. We're also recommending that school-sponsored activities like athletics and music and art, science fairs, theater, only occur once the kids are back. Full-time or hybrid in-person is underway with minimal disruptions. We want to make sure that just having that extracurricular piece is not a substitute for kids being in school during the day. Of course, those all are absolutely essential and critical and add so much to that learning experience. But the school should be back for at least hybrid, if not full in-person, before they add on all those extracurricular activities, because they are meant to complement and make the academic piece more meaningful. They're not meant to, of course, replace the academic piece. It's going to take all of us to ensure that our kids can safely return to school. It's not just up to educators and school staff, but students and parents to be responsible, entire communities, mask wearing, social distancing, help our schools return. So if saving your own life and your loved ones and protecting yourself isn't enough of a reason to avoid socializing wherever possible and wear a mask, making sure that we care about the next generation is yet another reason why we should do this. Now, I'm happy to turn it over to Colorado's talented, thoughtful Commissioner of Education, Katie Athas. Commissioner?
Thank you, Governor. And thank you, Governor, for prioritizing schools in so many ways that you have throughout your tenure and throughout your public service. I really appreciate it. I also want to thank this working group who have spent so much time and thoughtfulness putting these recommendations together, and thank Heath and Rebecca for their leadership as co-chairs of this group. You know, we know, just as the governor said, how hard this last 8 months have been across our state, and our schools and our educators and our students have had a lot of challenging times. And we also know that administrators have had to make really tough decisions, and decisions that don't always have the perfect right answer. But we all can agree how important in-person learning is. It's important socially, mentally, and academically for all of our students and our staff and our parents. We know that many of our rural districts have been in person, and that has been a wonderful thing. But we know that many of our more front range areas have struggled a little bit more because of COVID cases. We know how important our teachers are, how important their safety is. And so this work group talks about how to even increase the safety even more so as we work to get back to in-person learning after the holidays. Now we have more tools, more testing, more tracing, more knowledge about this. And so we have the tools at our hands to be able to prioritize in-person learning again. In addition to all the great actions in this report, I just want to accentuate what the governor said. We hope that our communities stand up and continue to do their hard work, which is masking, staying socially distant, because the less community spread there is in the communities, the safer going back to school is. So I really appreciate the efforts of this working group. And I believe I'm turning it over to our co-chairs, Heath and Rebecca. Thank you.
Thank you, Katie, and thank you again, Governor, for prioritizing education for our youth in Colorado. I think a couple of the things that I really wanted to highlight are things that we've heard already, but I think they're really important just to kind of remind everybody about. But the partnership between the educational system and public health is extremely important. It's always important, even when it's not during a pandemic. But right now, let's face it, in the past 10 months, as the governor highlighted, this has been a really challenging and difficult time. We've all made a lot of sacrifices. And I think at the same time, we've also had an awful lot that we could learn from, and we have done that. And I think that's what this working group was really convened to be able to do, is share some of those lessons learned across the state of Colorado with that singular goal of figuring out how is it that we can best get our students and our educators back into school for in-person or a hybrid modality as safely as possible and as quickly as possible. And so I just wanted to emphasize again that realistically, the need to protect health is critically important. It doesn't matter if you're a youth, a family, or an educator. This is important to all of us. And so one of the things that we have been able to learn in the past several months is that when you have these layered protections, as was already highlighted, that's critically important. And in fact, it does really create a relatively low risk environment. And so this is one thing that we wanted to be able to do, is take those lessons learned from many districts across the state and figure out what are the commonalities, what has worked really well, and how is it that we actually then codify that and make it into a plan for as we head into 2021. I just want to also convey my deepest appreciation for everyone in the educational system. As we've talked about how challenging it has been this past year, whether we are in a remote modality or whether we're back in person or a hybrid, the fact of the matter is that this has been a pretty significant strain. It's added stress on an already very difficult job to educate our youth, but doing it in a pandemic and taking on additional roles to try to create that safe environment. I just want to say to each and every one of you in our educational system how much the rest of our community appreciates what your role is and what you're doing on behalf of our community. I think the other piece that I really want to highlight here is we all want to get our youth back into school as quickly as possible. We all want to get our youth and our teachers back into that educational system as safely as possible. And so we all have a role to play. And that role, quite simply, is doing our best to decrease the spread in our own communities. That's the single most important thing we can all do to help our youth and to help our educators, is decreasing then those gatherings, decreasing any of the interaction that would put us at greater risk for transmission or exposure. But the more that we can do as a community to actually reduce the transmission, the better that we can support our schools. After all, that's probably one of the key things that we can certainly contribute to in reducing that risk for all of our educators and our youth. And so again, many thanks to the governor, many thanks to Katie and to Rebecca for your leadership in this effort. It's just been an honor to serve with both of you. And so I'll turn this back over to Rebecca.
Thank you, Heath. I would echo the gratitude for teachers. And as a former teacher myself, I'm leading with a lot of humility this year. Those of us that have been out of the classroom for a while have really no idea how much nimbleness, how much inventiveness this year, all of 2020, last school year and this year, have required of our educators. And we know you're tired and that this is really asking you to say, we're not there yet. That to the governor's point, it's the beginning of the end. And we've just got one more, I think, tough semester to push through. So just leading with a ton of gratitude for our state's educators. And the other thing Heath mentioned is that this report was an opportunity for public health and education to come together. That's been happening at the county level with really significant success in some places. But we realized we don't always speak the same language. We don't always have the same cycle times. We don't always have the same constituents. And so the roadmap really is a chance to see where we can continue to increase the way that public health and education works kind of hand in glove together for the next semester and the next year. The other lens that I bring to this report is just that as a mom. It's probably been my hardest role this year. I know lots of other parents feel the same way. And we know that families have said we've got to find the safest way, but the best way to have as many kids in school as possible. I've watched my own kids struggle with remote learning, despite the heroic behaviors of their teachers and their schools. And when I shared the evidence of this report with one of their school leaders this morning, she said to me, you know, Rebecca, we struggled. We weren't sure if we could ask families not to travel. We weren't sure if we could ask families to quarantine if they do travel. And a report like this gives us the courage to ask our families to have that reciprocal accountability that we know we all need to keep our schools open. So if we give that kind of shot in the arm confidence while we're waiting for the other shots in the arm, I think that goes quite a long way. So just want to thank you, Governor, Commissioner, and Heath for giving us this opportunity to strengthen the state's efforts for the remainder of this effort.
Thank you so much, Rebecca, Heath, Commissioner. Working families, our economy, and the future of our state rely on consistent, safe, in-person learning for Colorado students. And we want to do everything that we can to prepare our students for success. Give them a safe, consistent place to learn is absolutely essential. Make sure that we protect everybody that works in a school environment. But it's up to all of us to do our part. And each one of us has a role to play. Slowing the spread of the virus must continue in our state. We need to wear masks when we're around others. We need to stay 6 feet away whenever possible and avoid social interactions with those outside your home. Now, of course, in school, many are going to be, it's the layered piece. It doesn't mean kids are 6 feet away from one another. They're not. They're often closer, but you do whatever distancing you can in a classroom, whatever ventilation you can. The masks help. The screening helps. All of these things together create one of the safest working environments that we have in the state of Colorado. As we approach 2021, we really can see hope on the horizon. We need to stay disciplined, to work hard to continue to get these numbers down. We can't take it for granted that there is widespread community transmission now, and many cases are asymptomatic. While we're almost there, we need to redouble our efforts for a successful return to school, a successful return to work, so that we can once again get the benefits that we want for our kids, for our future, from our schools. This has been a difficult pandemic for every human on earth and every Coloradan in different ways. Some have been directly impacted by the health side, among those who lost family members to COVID. Others themselves have suffered greatly and recovered. Many have had psychological impact, economic impact, social impact. It's really tough on everybody. Having more normalcy in the ability of kids to go to school and teachers to safely resume in-class instruction is really an important and big step for our society, because schools are a foundational aspect of our society. The role they play for psychological health, for emotional health, for academic preparation, for workforce is so immense. And as a society, we value our schools. And that's why we are focused on working with all of our school districts to resume in-person education for the upcoming winter and spring semester. With that, we'll open it up for questions.
Hi, thank you, Governor. This is Erica Meltzer from Chalkbeat. We've heard about the need for more testing, more rapid testing, more contact tracing, and then also about significant staffing issues. Are there specific resources that the state can make available to school districts, especially as we head into 2021 and that first round of CARES Act funding is largely used up?
Yeah, we have. We are recommending in the report that schools are able to have on-site testing for anybody who's symptomatic. So little Johnny has a runny nose, instant test. The teacher has a symptom, instant test. We have plenty of supplies to do that. We're encouraging prioritization at our community testing sites and county health for testing for those who want it that are associated with school communities, even those without symptoms. But of course, priority to make sure that every school is able to test those with symptoms. Let me go to our county health director, Heath Harmon, to talk a little bit more about the focus on testing and resources in schools. Heath?
Yeah, thank you, Governor. I would highlight also, I think, as you take a look at community by community, sort of how they're going to roll that out and have that access for testing, it's probably going to look a little bit different. But it's critically important. Not only is it important, obviously, to identify those that might actually have a COVID-19 infection, but as we think about those that have been exposed and are currently on quarantine, to be able to kind of re-enter into that school environment, either as a youth or as a teacher, at the earliest possible point, it's still going to require that negative test. And so I think realistically, that's going to be one of those pieces that's really important. So no matter what the size of your community, no matter where you're located, I think that testing resource is going to be critically important and something that we're all going to continue to work on.
And Heath, you probably know the guidance better than me, but I believe if we want to, one of the frustrations and challenges schools face is the quarantine requirements. So obviously quarantine can be necessary, but with the new science-driven CDC guidance, effectively they can, if they test negative after 7 days, they can return out of quarantine. Is that how that works?
Yeah, that's pretty close. I think realistically they can return after 7 days of quarantine if they have a negative test result and remain symptom-free. And that test cannot be collected any earlier than day 5 after that last exposure. So it is a pathway. It is data-driven, and it does allow, I think, our youth, our educators. It also allows anybody in our workforce to be able to get back to that job a bit earlier, which is really important. Ultimately, I think what I would offer is, from my own perspective, it's probably going to help improve compliance as well. Let's face it, a 14-day quarantine period because of the incubation period, it's very sound and very important. It's also really hard for a lot of people to comply with for that length of time. So I think realistically, with the data-driven recommendations now from CDC, that is positive for the state of Colorado.
And yes, we're also committed to expanding and extending our 50 community-based testing sites and working with those sites to bring them to school communities. Next question.
Hi, Governor. This is Joe Vaccarelli from Denver 7. With schools getting ready to reopen, I mean, should teachers be more of a priority to receive a vaccine so they can do so more safely? And why are they not higher on the list than where they are, I think, in just with the general population?
So they are. Teachers have been going above and beyond during this pandemic. They're in phase 2 of the vaccination. The people who work around the COVID patients in the COVID wards and the nursing home, much higher risk. But yes, teachers, educators are elevated as those who should be prioritized with the vaccine. It's also important to note that the timing of that vaccine is unlikely to affect the classroom practices for this coming semester, because while there will be teachers inoculated, hopefully February, March, April, that's just the first one. 30 days later, the second one. So if you get inoculated, March 20th, you're not really immune until the beginning of May, because you get the second one April 20th, and then it's the end of school. So that's why we have all this layered protections for teachers this semester. The vaccine will hopefully protect teachers for summer school for next year, but the layered protections are critical for this coming semester.
Governor Steve Steger from 9 News. 2 questions. First, we've heard for weeks about this idea of a Thanksgiving surge, and if you look at the numbers, things seem to be declining. What are your epidemiologists telling you is the reason for that? Do restrictions play a role in it? And the second question, how much do schools going to remote play into that number of reduced cases, kind of attributing this Thanksgiving surge that doesn't appear to be appearing?
Yeah, so nationally, there is a Thanksgiving surge, record-breaking cases, record-breaking hospitalizations, state by state. Some states have a surge and some don't. Thankfully, Coloradans did very well and were thoughtful collectively about Thanksgiving. It doesn't mean you don't know somebody who did the wrong thing for Thanksgiving. We all do. But by and large, the numbers bear out that Coloradans made good, science-informed decisions to keep their families safe. And that's why we've not experienced the same Thanksgiving surge as other states and then the nation in aggregate. And we're encouraging people to have that same thoughtful, data-driven decision-making around your Christmas plans. Very, very important for folks. Celebrate with your family, those who live under the same roof. If you do want to have others come together, start that quarantine now for Christmas, right now, where those involved are quarantining, and be safe about how you do that. So we have to continue that work. I think you asked about schools. There's really not been a lot of difference in transmission between communities that have been fully back at school and those that haven't, which gives us further confidence that schools are not a factor in significant community transmission. Many districts in Colorado have been fully back, others partially back, others not back. Really no real difference in the transmission levels in those communities.
Hi, this is Erin Prater with the Gazette in Colorado Springs and Denver. I'm going to try to squeeze in 3 questions, if you'll bear with me. The first is, when can schools expect to get these rapid tests? Will this be in time for the beginning of school resuming in January? The second is, in this work group, discussion of improving virtual education for medically fragile or high-risk children, for whom in-person education probably won't be a reality until they can get vaccinated. And we know these vaccines are only for 18 and above right now. Many of these children are on IEPs, and I know at least some have been on ISPs with reduced services, making sure they don't become even more impacted than they already are and even more disadvantaged. And my final question, deaths among cases are approaching 4,000. Do you have any thoughts on this? And are we still expecting to see 6,000 to 7,000 deaths this year due to COVID or among COVID patients? Thank you.
So rapid tests are available today. And Heath, I'm sure, Eagle County's got some allocation of the Binax tests, and those are the quick ones, and others. Do you want to talk about how you can partner with schools to do that?
Yeah, absolutely. I think, and again, every community is a little bit different based on in terms of their resources, but that rapid testing, the Binax, as the governor just highlighted, is one thing, at least certainly our community has been very grateful to receive. And so we continue to receive shipments and make orders on a weekly basis, turn around. We get those actually test back into the community. For us in Eagle County, what we end up doing is we rely very heavily on our medical providers to provide that rapid testing. They also have the knowledge of the patient, some of the other background information. And so what we've really worked on here is just to try to make sure that all of our medical providers have access to that rapid testing. And that way, all of our community members, regardless of which town you live in or what school you go to, you still have access to that rapid testing. One thing that we found extremely valuable is making sure that when we're talking about school settings, we want to make sure that we can turn around that test result as quickly as possible. And so right now with that rapid technology, we have the ability to do that in 24 hours or less. And so that's been super important for us, as I'm sure it has been for most communities around the state.
So school districts should first work with their county health department, but if they're not getting what they need from county health department, they're absolutely welcome to put in requests from the state, just as the state worked to get masks directly to teachers. And part of the report is we should continue to do that and actually offer not just the very high quality KN95 masks. Apparently some teachers don't like wearing those all day. I don't blame them, although those are the most protective, but also surgical masks. So this type of mask might be, in many cases, slightly more effective than a cloth mask, which they traditionally wear. Not nearly as effective as a KN95, but it might be somewhere in between. So that is something that we want to increase the availability of, to give teachers that choice of what kind of mask they want to wear. Medically fragile students. First of all, for the districts that are only partially back or hybrid, and what does hybrid mean, by the way? That means the kids are back 2 days a week, so they're on different schedules. It's a funny word. It means that there's two different groups and they're each back 2 days a week. So at least your kids are getting in person 2 days a week. It's better than 0 days. It allows for much smaller class size. So some districts are doing that. But for districts that are not fully back or hybrid, we do ask that they prioritize students in IEPs, those who are most vulnerable. I know the number of school districts have had offered kind of the full day for the families that absolutely need it. So that is relevant. Now, of course, there's also a decision for those who are what you call medically fragile. Those who might be isolating because they're at great risk of the virus, live with their grandparents or great grandparents, want to continue the online. There are some families in that category that make that decision themselves. I'm not ready. I'm not ready to go grocery shopping. I'm not ready to leave my house. I'm not ready to go to school. And they should be able to, and they are able to continue with that online if a medically fragile grandparent is raising kids or the kid themselves is. And finally, we have over 3,000 Coloradans who have died from this virus. The estimates and the updates from the modeling team will come with their next model. And we'll await those. We've seen as I said, hopefully a flattening of the spread, and then potentially we'll watch over the next few days to see if this is going down in Colorado. But at the same time, we also have 5 times the number of hospitalizations that we did just 2 months ago.
Governor Charles Ashby from the Grand Junction Daily Sentinel. I too have a couple of questions, although my first one may be a bit premature since we're only in the second day of the rollout. I remember last week, one of your Scots said that you had built in a protocol for being able to react to problems quickly. And I'm wondering if there have been any problems that have shown up, particularly on bringing it out here to the Western Slope. My main question, however, is about people like you and Marlon and other people who have contracted the virus and who have gotten negative. What's the protocol for them in getting the vaccine? Do they need to? Should they give up their vaccine if they're on the list right away to somebody else?
Yeah.
Do they need it? I mean, what?
Thank you. That's a really good question. So currently, those who have had COVID at any point does not change their priority for vaccination. It may change their personal decision about vaccination, but because so much is unknown about the duration and the level of protection from previous infections, when it does go to a nursing home, it'll go to the 70, 80, 90-year-olds and staff members who've already had COVID, as well as those who have not had COVID. There's simply too many question marks around the level and duration of potential protection from an infection event. So it does not change the priority at this point. It may change people's individual decisions based on when they choose to get that and how they prioritize it in their lives. It would also, from a practical perspective, Charles, be very difficult, if not impossible, to add that level of complexity to the process around who gets it and who doesn't, especially considering that a certain number of people who've had it might not be have it confirmed whether they've had it or not. Probably half the infections in the state were not necessarily diagnosed with a positive test result or more. Finally, there's no distribution problems have been brought to my attention yet, meaning that there's not been any issues that have been raised to me of the freezers or the preservation. We are not yet 72 hours in, so there's not any redistributions yet from those who weren't able to administer it, but we'll certainly keep the general public updated and with transparency about the deployment of the vaccine in Colorado.
Hi, Governor. John Daly, Colorado Public Radio. Thank you for taking our questions today. I was wondering about the vaccine and how much of the return to school plan will depend on folks in the schools, I guess teachers in particular, but also other people who work in the schools having gotten vaccinated in order to reopen the schools.
None of the plan relies on that, because if everybody was vaccinated, we wouldn't need to do all this paperwork. People would just be back in normal school. This is about having safe schooling during the pandemic, just like we all try to be safe in our lives and when we shop at grocery stores, when we're limiting our social interactions. So it's about how school can be done in a safe way for educators, for kids. If everybody was vaccinated, we can. Some of this might be kept, but I think for the following school year, this will largely just be thrown out. I don't think people need to do all this stuff once everybody's vaccinated. So this is very much for this coming semester. Some of it may endure, as I said. I mean, these are good for health. I don't know. Do people want to keep symptom checks going? Do they want to keep windows open where they can? Maybe they do, maybe they don't. But things like mask wearing will go away. A lot of the layers are clearly going to go away for the following school year. But this is for this school year, this coming semester, for school to safely occur during the pandemic before we have mass vaccination.
Hi, Governor. Jesús Carrasquel from Noticias Univisión Colorado. Gobernador, ¿puede darnos un resumen en español de su anuncio y decirnos si es seguro volver a la educación en persona antes de que todos ya hayan recibido la vacuna?
Si los distritos y las escuelas toman las precauciones correctas, la educación en persona es muy segura. Además, es muy importante para los estudiantes, no solo por la parte académica, este es importante naturalmente, pero también por la salud mental, por los trabajadores. Esto es especialmente importante para muchos niños quienes están aprendiendo inglés, incluido hispanos.
Hey, Governor, this is Gabrielle from Fox 31. Have two quick questions for you. The first being that we know all outbreaks around the state are down, but per the state's outbreak chart, at least as of last week, schools are still the second largest source of outbreak behind inpatient healthcare. So I wanted to know, is bringing students back one of those situations where the reward outweighs the risk? And my second question here is that we talked a little bit about it on Friday, especially looking at that Northeast Colorado teen. Just wanted to know more about mental health. How much of this roadmap focuses on that? And are there any plans at the state level in this roadmap to specifically address that area?
Yeah, when you look at the school-based transmission, you see that the safety guidelines that have been in place have largely been very effective, meaning you see 3, you see 2, you see 4. You don't see 28, 86, 115. So what does that mean? When you look at any potential outbreak, restaurant, grocery store, local business, containing it and preventing that broad community transmission within that community is really the goal. And the confidence that I get as governor, that school districts get from that having been done successfully with in-person education during the pandemic, can further highlights the value of these layered measures that can prevent outbreaks from becoming extensive in any work environment, and in this case, in a school environment. What was your second question? Oh, mental health. Schools are essential for mental health. I mean, look, it's about academic success, of course. We want our kids to succeed. We want them to have good jobs. We want them to have a bright future. But it is so much more than that, right? I mean, think about what you remember from school. It's about social, emotional, mental health, the feeling of belonging, being part of something. It's the benefits of in-person education are well above and beyond the academic piece, even though that's the core function of our schools. And that's why it's particularly important that Colorado students have the opportunity to return in this upcoming winter and spring semester. Rebecca, do you want to address that, or?
Absolutely. At CEI, we've been supporting school districts all year on how they reopen, whether that's virtually or in person, with relationships at the center. And that's really what helps schools have such a buffering impact on stress, is that you're putting peer-to-peer and adult-to-peer successful, healthy relationships all around young people. We've seen, obviously, young people, particularly who are in transition years, really struggle. If this is your first year of 6th grade or 9th grade, or if this was supposed to be your senior year, we know that in particular for those groups of kids, getting them back to positive relationships and positive routines as quickly as possible is one of the most important things we can do. And as parents, we give that advice too, that using this break to say, how do we reset the routines? How do we have students do some self-reflection about what's worked and what hasn't worked in our own lives? It's something we need to do as adults, and it's something we need to help our kids in our own homes do too, is to figure out what relationships, what routines are going to help us buffer stress. The easiest way to do that is to have kids back in school as quickly and safely as possible.
Governor, this is Nelson Garcia with 9 News. I just have one question going back to the issue of teachers and vaccinations. If schools are so important to the foundation of society, why not elevate teachers to phase 1 and have them vaccinated so they can work in their minds safely in the first semester? Is it a problem with the numbers of teachers that work in Colorado? Is it a logistical issue?
So teachers are prioritized. The first goal of the vaccine is to save lives. The second goal, end the pandemic, right? Saving lives, nursing homes, people in their 70s and 80s. You have to look at the science and the data around the fatality rate from this virus. It's not 2 or 3 or 4 times more fatal for somebody in their 70s and 80s than somebody in their 20s or 30s. It is 100 times more fatal for somebody who's 86 than 26 or 36. So with that lens, it is absolutely critical that we protect those that have a fatality rate that is 100 times higher than you, than me, than a teacher, any worker that is 30s or 40s or even 50s. So it's really important that we align, that we align that. Now, among that very first group, after the people that work in COVID wards and healthcare workers, those who are most vulnerable, over 65, very first group is teachers and some of the other frontline essential workers, which will be prioritized because return to school is a societal value. Now, in terms of the school year, with any prioritization, vaccinations will be in place for summer school and next school year. So again, it's that timing, even with the priority that we're giving educators and essential workers, it could be, for instance, mid-March. And that means that that's the first shot. They get the second one mid-April, and then they're immune in May. That's when the school year ends. That's why there's such a thoughtful, diligent work around how we can safely operate this important institution in our society safely for educators and kids in this coming semester.
Hi, Governor. Tina Pichardi with the Denver Post. Everyone on this panel on the importance of reducing community spread of COVID-19. I'm curious, what is the threshold for community spread that enables a safe reopening of schools, and what metrics do you guys plan to use to determine that? Thank you.
So I'll address it briefly, and I can certainly, if any of the others want to, on our dial system, in a purple stay-at-home situation, schools would not operate. They could still operate hybrid if they wanted to, but in that situation where the hospitals are at capacity, urgent action is needed, like last March, then many other areas like schools would not be in person. Schools can safely occur at any other in-person education. Let me start again there. In-person education can safely occur at any other level of the dial. For counties that are in red, it should be prioritized for K to 5. The risks are lower and the benefits are greater for P to 5 in any county in our state that's red on the dial. Anybody else? Heath, do you want to address that?
Yeah, I'll add maybe a few things. I think it's important to understand that, there's no doubt high level of community transmission is going to impact any sector of our community. And so that's going to be true for our educational sector, right? But that transmission primarily is not taking place in those school settings. So I think actually what we've learned over the past several months, and whether you're looking at the state of Colorado, you're looking at the US, or you're looking globally, what we continue to see is that actually schools and classrooms can operate with lower risk when those layered protections are put in place, even when that community transmission is at a higher level. And so I don't know if anybody else has anything to add.
Thank you. Next question. Was that Riccardi? Was that Teeny Riccardi? Or is there one more? I think that might be it for the questions. If there's speak now or forever hold your peace. Please, everybody, have a safe Christmas. If you do want to see your family, please start that quarantine right now. Right now, it's we're just 10 days from Christmas, and if not, be safe. Look at virtually getting together. Look at a Christmas in July for the festive part of it. 2 Christmases next year is more fun than one. But let's make sure that just like Coloradans successfully stepped up for Thanksgiving and we didn't see a spike, as we head into the rapid deployment of the highly effective vaccine, we want to make sure that we're also not heading into overflowing hospitals and unnecessary loss of life because of abandoning the principles of safety that we know we need to live during the Christmas season. Merry Christmas, happy holidays. Thank you, Colorado.